Okay, good evening everyone. I am Councillor Lewis, Vice Chair of the Scrutiny Committee and chairing this meeting this evening, and I'd like to welcome you all. I'd like to introduce Carol Malpass from Democratic Services, who will be supporting me today. I would also like to thank members and officers who are joining us this evening. There are no fire alarms scheduled this evening, so in the event of an alarm, please leave by the nearest fire exit. Please be advised that this meeting will be recorded and subsequently uploaded to our YouTube channel for public viewing. Members are kindly asked to raise their hands when wishing to speak and to ensure a smooth recording process. Could you put your mics on, please, when you wish to speak? Scrutiny is a cornerstone of good governance. It allows us to hold decision makers to account, examine policies and performance, and ensure that the voices of our communities are reflected in the work we do. Our role is to provide a constructive challenge, not to criticise, but to question, understand and help shape better outcomes. I encourage open, respectful dialogue and welcome contributions from all members. Today's agenda includes important items that deserve our full attention and thoughtful discussion. Let's work together to ensure this meeting is productive, focused and beneficial to the communities we serve. Thank you, and let's begin with Agenda 1. So, apologise for any absence. So we have Councillor Tromans and Councillor Hanif. Sorry. Okay, thank you. And do we have any substitutes?
Yes, I'm substituting for Councillor Hanif.
Thank you, Councillor Cobb. Agenda item 3, any declarations of interest? No? Thank you. Agenda 4, anybody, public forum? Agenda item 5, movement of some outpatient services to the Merrill Centre, pages 4 to 9. Can I invite Ian Chadwell to present the report, please, and can I ask members to keep any questions until the conclusion of the presentation, please? Thank you.
Okay, thanks very much, Chair. What you have here, I'm Ian Chadwell from Dudley Group. I'm joined by colleague Helen Codd, who's also from Dudley Group as well. And back in March, we came to committee to talk in broader terms about our longer term intention to move suitable outpatient services away from Russell's Hall and hospital and provide them in community settings that are easier to access wherever it's possible to do. At that point, we did not come with any specific proposals, but indicated a general direction of travel that we wanted to go along, recognising that the pressures on the Russell's Hall site are severe and experienced by both our staff and our patients on a daily basis. So the more that we can do to provide services that are in locations that are easier to access, the better for everybody. Picking up on that initial kind of scoping, we then, we're now bringing to you proposals specifically around Merry Hill Centre, where we've been running adult blood test services for the last three or four years, quite successfully, and proven very popular option with those taking up the service. We've now been able to secure a slightly larger facility within the Merry Hill Centre. It's next to Next, isn't it?
It is.
Yeah, that will enable us to provide more services. So what's happened in the last couple of weeks is that the adult service has moved from downstairs to upstairs and the new facility, and it's our intention to extend the offer to paediatrics, to children's blood tests, because at the moment those are all having to be done out of Russell's Hall, and you can imagine some of the constraints that there are on families in having to access a car park, paying for that, and then entering a very confusing white building. The move will also then enable the service to be open for longer hours, including Saturdays, which will make it possible for families to access the service out of school hours. At the moment, the service is only available on a 9 to 5 basis, which then means it's very difficult to, it might mean that children have to miss school unnecessarily. So alongside that, there are also 4 outpatient consulting rooms that we've been asking our services to indicate which ones they think would be suitable for relocation. And a number, as outlined in the paper, there's a number of our maternity clinics and paediatric services that have indicated that they think Merry Hill would offer a better location. Probably want to underline particularly the maternity one, the rainbow clinics that are for families that have experienced pregnancy and neonatal bereavement. The hospital can be a very intimidating environment with a lot of memories for families in that situation. So we think the Merry Hill Centre will provide a slightly less stressful environment. So the facility has been secured, and the timetable over the next few weeks, as the adult services have already moved upstairs for the blood tests. It's the intention to move the outpatient to the children's blood tests at the end of this month, and then maternity and paediatric clinics over a phased period from January through January and February next year. The clinic rooms, there's 4 of them. So we're offering a session in the morning and a session in the afternoon. So once we get to 8 clinics in a day, then we're at maximum capacity. But obviously we're exploring the options for weekend working as well. So we'd like to bring this recommendation to you. The recommendation is that you support the relocation of these services as described in the report, given that in the scale of the total outpatient service that we provide as a trust, we do not feel that this can constitute a substantial change, because we're talking of a few hundred or maybe 1,000 attendances in the scale of 300,000 outpatient attendances at Russell's Hall at the moment. So, and services for maternity and paediatrics will remain at the Russell's Hall site.
Thank you, Ian. Can I open questions to members, please?
Thank you. Thank you, Chair. Just to say, anything that would relieve some of the pressure on Russell's Hall is to be welcomed. But this for the children, especially the fact that it will now include Saturdays, from the children's services point of view, that really helps with attendance. And I think that's quite important, that we do everything that we can to encourage children to attend school, and the fact that they can now go for blood tests on a Saturday will actually help. My only criticism of this is one that we always have, especially from our end of the borough, whatever the medical services, all the way to Russell's Hall or Merry Hill is quite a way, but it has its advantages in taking the pressure off, and they can park for free at Merry Hill. So I have no further comments to make or questions. Thank you.
I go green? No? It's working. Okay. No, I fully welcome this as a long-serving employee at the Dudley Trust at Russell's Hall, who are already as an extra hour on her working day just to park. So I thoroughly welcome this. The only thing that sort of jumped out at me, as a person of the borough who personally avoids Merry Hill at all costs, unless I really have to go, we all know what a nightmare it is down there at Christmas time. So I was just wondering if we relocate the services there, as I said, fully for that. I was just wondering if there was any sort of way that spaces could be ring-fenced for people who are attending outpatient services down there, because sometimes over the Christmas period, you've got the intention to go to Merry Hill to shop, and 9 times out of 10 I end up turning around and going home again, because you can't even get anywhere near Merry Hill, never mind park on Merry Hill. So I just wondered if that had sort of been configured into the plans, because I do feel that if all the services are down there, then we could, if it could somehow ring fence a few spaces on that back car park right by the door where the new centre is. So that's just my thoughts I'd like to bring to the arena tonight. Thank you.
Thank you, Councillor Westwood. Is that something that you can look into?
Certainly something we'll go away and look at. I'm going to hand over to Helen, who's been in conversation with the management of the centre.
Thank you. So we've been having extensive conversations with the management at the centre to see, what's possible and what isn't, and it's something we can definitely raise. We have been working with a few patient groups to understand accessibility issues, and it's been really useful for us to understand the issues, reassuring for them. They've also asked the same question around parking and worries about Christmas. And I know the staff, even at Russell's Hall at the moment, people are late because of the parking issue. So we expect that at Christmas, and staff will accommodate those, people perhaps being a bit late due to parking, etc. But definitely something we'll raise with the management at the centre. Thank you.
Thank you. Jason, thank you.
Thank you. Thanks both. Just a question in the terms of accessibility. Again, I sort of echo comments that have been made. Welcome the fact that there's that greater choice and taking away some of the burden from Russell's Hall. But is there still mobility support at Merry Hill? Because I know Age UK used to have some wheelchair provision. I'm just conscious of where it is located. Great for people that are driving there, but if you are getting the bus in, it is a bit of a trek to the other end of the centre. So I was just wondering if there's any additional support in case anybody needed mobility help.
Thank you. Just making sure you can hear. So yes, we've done a walkthrough from the main bus station up to the centre, because it is actually, it's a good 10-minute walk, and if you've got mobility issues or COPD or something, then it can be difficult. There is a wheelchair hire place, so the patient leaflet that we've developed in collaboration with the patient groups has got lots of information in there about accessing things even such as a radar key, which I'd never heard of. There's accessible toilets, there's hoists, there's wheelchair hire. We're trying to speak to the bus companies to see if they'll take some leaflets, so that if people are on the bus and asking where can we, where is it, they'll hand those out. We've listed which bus services stop where the taxi rank is. Some of it is very, it's quite governed by Merry Hill itself, so we're having to work within those confines. But I guess if somebody had a real difficulty in getting there, there's still a choice as well about where they can go for those blood tests. They don't have to go to Merry Hill. They can choose to go elsewhere, but we're always happy to listen and take that feedback and, see if there are issues. Thank you.
Thank you. If there are no further questions or comments, I would like to refer members to the recommendations set out in the report under paragraph 2 and ask the officers to note comments made by the committee. And does the committee agree? No? Thank you. Okay, thank you. Agenda item 6, Dudley Safeguarding Children's Partnership 2024 to 25 annual report, pages 10 to 43. Can I invite Gillian Ming to present the report, please? And can I ask members to keep any questions until the conclusion of the presentation, please? Thank you.
Thank you, Chair. It's actually myself who's going to present the report. I'm Vicky Buchanan. I am the independent scrutineer on behalf of the Safeguarding Partnership from a children's perspective. So this annual report today focuses very much on the work of the partnership in relation to children. Just to explain, as an independent scrutineer, it is my role to be that critical friend to the partnership. So I'm not employed by any of the agencies involved. I do approximately 20 days a year on the children's side, and it's my role to kind of bring that support and challenge to the partnership about whether or not we're making a difference. I've prepared I'm conscious it's a 26-page report, so we've got a slide deck here just to help. So what we're trying to do today is to give you an overview of the report, introduce the joint arrangements for safeguarding functions, which are driven under the auspices of the Dudley Safeguarding People Partnership. And here in Dudley, our partnership is all age. So whilst this report's focusing on children, we do work collaboratively with our colleagues and adults, recognising that children don't live in a vacuum, they live with families and adults. Our governance structure straddles those two statutory groups with our Dudley Safeguarding Adult Board and our Dudley Safeguarding Children's Partnership Group. The focus and remit of the report summarises the effectiveness of the safeguarding arrangements for children, and as the independent scrutineer, I can say the report is a good reflection of where the partnership's at. The report aligns with Working Together 2023 requirements, and that's basically the statutory guidance that underpins all the work of the partnership and how we work together to safeguard children. It evidences collaborative multi-agency working, and it outlines the scrutiny activities and assurance effectiveness across the partnership. It's now published and it's shared with the Department for Education, Ofsted and National Panel. So there is a lot of people who look at this report as well. And we do get some feedback from them about the work that we do. So under Working Together 2023, we talk about the lead safeguarding partners, and the lead safeguarding partners are the Chief Exec of the local authority, it's the Chief Exec of the Integrated Care Board, and it's the Chief Constable in the police. So there's an expectation that they have a really good understanding of how safeguarding works in the local area. It's their role to set the strategic direction and vision and the culture of the local safeguarding arrangements. They lead their organisation's individual contribution to those shared priorities, ensuring there's strong governance and accountability. And they review and sign off key partnership documents like the annual report. And we also have to publish multi-agency safeguarding arrangements. So if you go on the DSPP website, it tells you how we work together as a collaborative group. They provide oversight of learning from independent scrutiny. It's the role of the safeguarding partnership to look at all serious incidents, so local child safeguarding practice reviews, national reviews, and to ensure that those recommendations are implemented and have a demonstrable impact on practice. And just this morning, we've been in a development session across our adults and children's partnerships, really sort of looking at some of those themes and the learning that we need to think about. We ensure multi-agency arrangements have the necessary level of business support and that all relevant agencies, including education settings, are clear on their role and contribution. And that kind of enhanced role of education came through very, very strongly in Working Together 2023. Education have always been involved in our partnerships, but it really kind of raised the importance of education in safeguarding our children. This slide just shows how the structure. I'll take you through it a little bit. So in the middle, we have our executive group. From a children's perspective, these are known as the delegated safeguarding partners. So Gerard has been the chair of our executive for the last 6 months. And that's also attended by the Borough Commander for the police and the Deputy Chief of the ICB, Sally Roberts, and also the Borough Commander on behalf of the police. And we've recently had our Director of Education involved as well, again, raising that profile of education in that space. You can see there that we have our two main groups that meet, our Dudley Safeguarding Adult Board and our Dudley Safeguarding Children's group. So they do a lot of the kind of work of the partnership. And then we have a quality assurance and performance subgroup and a learning and an improvement subgroup. And that learning and improvement subgroup really focus on our learning from all those reviews that I've just mentioned. We then have priority groups, and for the 24-26, which this annual report covers, which is 24-25, we've had a focus on mental health, frontline practice, transitional safeguarding. So that's where young people are transition points for young people, where we do have worries about what help and support they're going to get as they move into adulthood. So that transitional safeguarding group really look at those young people. And of course, we have an exploitation subgroup, and they're two separate groups, one that looks at adults and exploitation, and one that looks at children subject to exploitation. And we have a training hub, and if you go on the website, there is a strong training offer from the partnership. So in terms of our 24-25 annual report, it gives you a snapshot of the Dudley population profile. It tells you about what's happening in the early help space and our, 5 family hubs here in Dudley. It tells you about children receiving multi-agency statutory intervention. So that's our young people who are either children in need or on a child protection plan, or indeed some of our children in care. And we look at the reasons why children are subject to child protection plans, and what that means, and therefore where do we need to focus our attentions. We look at children with disabilities who are often underrepresented in terms of some of the work that we do, particularly around child protection plans, because we know there's additional pressures on families where there's a disabled child. Our local authority designated officer has a role where there are concerns about people who are working with children. So if an allegation comes in, for example, about health visitor, about a teacher, about a social worker, or anybody, it could be a sports club, anybody who's in that kind of responsible role with children, they are part of that. We would, investigation into whether that there are any concerns. We also look at private fostering, and private fostering is it's not fostering as you know it, and it's not really helpful that it's called private fostering, in my view, because I think it causes confusion. Private fostering is when a child is staying with somebody who's not a member of their own family for a period beyond 28 days. And the local authority in particular have a responsibility to go out and check whether that's a safe arrangement for that child. It doesn't mean that they're a looked after child and in the care of the local authority, or that we are paying those carers. That's an arrangement made by a parent or a person with parental responsibility outside of any kind of local authority involvement. So it's really unhelpful that it's called private fostering, but we're constantly trying to raise awareness of it, because colleagues do need to report if they believe that a child's in one of those arrangements. And councillors will remember this was all very much around Victoria Climbier back in the 90s and her experience. She was in a private fostering arrangement. Our Safeguarding in Education reference group, where we look at children who are missing education, children who are electively home educated, and sort of really keeping that focus on safeguarding in education. And we know we need to get better at evidencing the voice of children and young people. So whilst we've given you lots of examples in the report where we've done that, we know it's something that absolutely we need to get better at. So in terms of some of the key work of the executive and the subgroups during 24-25, what we said we would do and how did we do it. We've had our strategic priorities, as I've described. We are starting to evidence the voice of children and young people, but as I've just said, not enough. We really do try to learn from our rapid reviews and child safeguarding practice reviews. Our development session this morning, we were talking about how we really close the loop on some of that learning and evidence what's changed as a result. And the above has provided an opportunity to review progress made in delivering the core functions of the Safeguarding Partnership. Independent scrutiny. We've undertaken a number of areas of independent scrutiny. That includes a deep dive into early help. And we were able to report a clear commitment from professionals to deliver the right early help at the right time for families in Dudley, with greater efforts required in the assessment process. At the moment, they tend to be very local authority led, and recognising that actually it's partnership that's needed in that early help space. We've had scrutiny of our child protection conferences, and our conferences were well chaired, they were family focused. We followed through with appropriate recommendations, including the need for improved police engagement, which, as a result has improved. And our multi-agency oversight remains robust. We have undertaken work around emotional health and mental wellbeing of our children and young people, which we can see early signs of improvements in practice and progress moving forward. And we did develop an action plan following the scrutiny work, and colleagues in public health have been undertaking an assessment across the age, adults and children, what's the need in Dudley. We have strengthened our links with the Community Safety Partnership, but we also recognise we need to do more. And one of the things that we talked about a lot this morning was domestic abuse and the prevalence of domestic abuse in Dudley, and that whilst a lot of work's done at the community safety, safe and sound board level, we need to ensure that we're joined up, we're working collaboratively across that agenda. The Learning and Improvement subgroup identified a need for improved processes to hold each other to account, making sure that we strengthen that exception reporting. And we've also strengthened our approach to multi-agency audits of practice. And this is where we sort of do a deep dive into some individual children and how have we worked together to make sure that we're making a difference. So just to summarise, there remain challenges, and we recognise that. There's lots of good work going on, but we always need to do more. The partnership has made some progress, but there's been lots of staffing challenges, lots of changes in leadership, difficulties within the business unit, and that has kind of hampered some of our progress over the last 12 months. I'm pleased to report that things are improving and looking up. So, we are optimistic for the coming 12 months. We really do need to have multi-agency data, and that has been a real challenge for us. Whilst we've got lots of what I would say is information, it's excuse me, that analysis and understanding of what it's telling us. And we're out to interview tomorrow, I do believe, actually, for a data analysis to support the partnership and really understanding where it is we need to focus our attentions. There's limited evidence showing how partnership activities have influenced service provision and improved outcomes. That's not to say it hasn't. What we're not very good at is, as I said earlier, closing that loop and sort of saying, and this is the difference it has made. That brings in that voice of the child, voice of the family again, because unless we're asking them what difference we've made, we can never be truly sure. Excuse me. Our data and quality assurance needs to be strengthened. and particularly to really make sure that we understand and assess equality across the child's journey. And we need greater involvement from children, family and community groups. So our commitment to the strategic plan, the partnership remains focused on mental health, transitional safeguarding and exploitation, although we've just had a development session, so from the 1st of April next year, those priorities may well change. We need to ensure we've got key lines of inquiry around early identification and support, multi-agency collaboration, training and development, quality assurance and public awareness, because we don't think that if we ask the public what they know about the safeguarding partnership, they probably wouldn't know. So we know that we need to raise our awareness with the general population as well. Excuse me, I've been talking all day. Our priorities for 2025-26 and ensuring we're compliant with Working Together 23. So we need to review our leadership and governance. Again, we've been doing some of that this morning. We need to ensure our agencies co-own the family safeguarding approach and understand our levels of need. We need to promote awareness of the Families First partnership, and that, I'm sure people are aware of the massive social care reform that's going on at the moment. We need to align our work with Working Together 23, and we need to embed that learning from those case reviews. So that's the slideshow, but obviously really happy to take any questions either on what I've just said or anything specific in the report. Thank you.
Thank you. Councillor Baton?
Can you go back on the slides to the slide before this one, please, with the challenges on it, progress and challenges? That's the one. So I can't really read them from here. But the problem is I can't talk into the mic and read that on the screen at the same time. That's the problem. So you'll have to just listen. I'll just have to shout and hope for the best. So the blue box where we're talking about limited evidence, what would good look like to you in that arena? How do you see that evidence being produced for you to have that level of assurance that you clearly need?
So I think it's a lot of the things that we've kind of talked about. So it is hearing directly from children, young people and families about what their experience is. It is having a really strong multi-agency data set that helps us to see that things are improving. Numbers are an indicator. They will never do the whole thing, but they do indicate whether we're moving in the right direction. And having that really strong quality assurance approach, where we've really kind of got robust auditing, and just on a really simple level, that a review that we've undertaken, for example, could say that we are not professionally curious enough. We don't ask the right questions. So then to audit and see that evidenced in how the multi-agency partnership works is how we would get that assurance. And it's not to say it's not there. It's just not as robust as it needs to be.
So I suppose the follow-up question to that is, how are you going to get to that point where you are assured that it is robust enough?
And that's the $1 million question, isn't it? So I think we have done an exercise this morning where we've kind of talked about the maturity of our partnership. And I think it's fair to say that the conclusion was we are not mature yet. We've got a lot of the right building blocks in place. There's a willingness as a partnership to come together and improve. Sorry. But we don't always work as collaboratively as we could do. So, but I think today there was a real strong commitment in the room and a recognition that we need to do more, which I felt quite assured by.
I shall look forward to next year's report then, where hopefully it will demonstrate that those improvements across the partnership have been made. Thank you.
Thank you, Councillor Baton. Councillor Rigney?
Thank you. One of the concerns that elected members often express, and we have expressed many times at Scrutiny for Children's Services, is homeschooling. And that always, it's not about the education, I think, because that is not what we are concerned about, safeguarding for those children. One, that the fact that they are often isolated from other children, and of course the other issues are with people, adults that they're actually mixing with during that process. I mean, I presume we are waiting for further government advice to come in the white paper, but it's a concern that has been expressed certainly across the last 5 years at least at Scrutiny as to how we can improve it.
You are right. The white paper will help to a degree, because it will actually give the local authority some powers, particularly where we've got children where we're worried that there's safeguarding concerns. I mean, you know that at the moment, actually, the local authority doesn't have any powers to visit or stop, per se, children who are electively home educated. Obviously, if a safeguarding concern comes in, they can. But I think what I would be assured about is we know who the cohort is, we understand that group of young people, we know those that are subject to early help, have SEND, are subject to a child protection plan, and actually the last time we saw the data there weren't any children in Dudley who were subject to a child protection plan and being electively home educated, which is reassuring. So the safeguarding and education group really focus on that cohort of children, and you know, I don't think there's anybody who wouldn't be concerned about that cohort of children for all the reasons that you have described.
Thank you. Councillor Dale?
Yeah, it was a really nice presentation, and actually really good to see that instead of, for once in this council, us saying that we don't do it, we've never done it. Actually, we've never done it. Let's go ahead and crack on and try and get to grips with it. And I've worked under similar restraints or constraints in other councils. It's really good. I've got one little question. I mean, for those children of ours that are in care systems outside of our control, so they live out of borough, how are we going to make this impact them? How can we take this out of Dudley and to them, or try to bring them back? What are we going to put in place for them? It's okay, obviously, to make robust decisions for those people that are here and under our control, but those children that live in kind of high strength facilities, in places that we can't control and outside of our, maybe 100 miles away, 200 miles away, what are we going to put in place for them?
Our looked after children or Dudley children, regardless of where they live. That would be my first point. All, as far as I would be concerned, all of this equally applies to those children. So our standards need to be the same, regardless of where those children and young people are. And I don't know whether I could put Natasha or Gerard on the spot to talk about some of the checks and balances you have in the children in care world. Okay.
Thanks, Vicky. Yeah, of course, we do visit those children regularly. There's a whole regime, as Alex will know, in place around that. We're not complacent about that because they are some distance away, some of those children. It's much harder to keep an eye on them when they're they're often in new schools, in new places. But we're very much aware of that and make sure that we have regular contact and visit them to do so, to make sure that we're keeping them safe, as well as they're developing properly in their placements and getting the best experience of being in care that we can give them. So it's a good point, Councillor Dale, that we need to just be reminded to keep very careful oversight of that group of vulnerable children, which I can assure you that we do. through their social work visits and through the also the independent chairs of their reviews who visit them regularly and keep in touch outside the mainstream social work contact. So there is there's another pair of eyes that's looking on in their care arrangements to make sure we're doing everything that we should be doing for them. I hope that helps.
Thanks, Gerard. Councillor Dale, do you want to follow up?
I'm still not got a hand on this. Yeah, just obviously on that, a lot of the time those children fall under the eyes of CAFCAS because they tend to be different types of, I guess, higher graded SEN kids or children that have been in large trauma-based backgrounds, and they may not have families to look out for them. Are we strengthening our relationship with CAFCAS? Because I know that's been an issue for us in the past. I know when you talk about working across multi-agencies, are we going to go down that road? Because sometimes I know we've ended up in court and it's not been great for us, as for a lot of councils across the country.
We don't always agree with CAFCAS, by the way, because they're an independent challenge to us. They don't always stay involved in children's lives. They're involved in the decisions when proceedings are underway. But of course, they are very influential. We do listen to them. There are social workers like us, actually, so they're not some sort of magic breed. They've greater insight than we do. But they provide, again, that's part of that independent oversight. In addition to independent reviewing officers, CAFCAS will want to be assured of the placements, particularly in those most vulnerable children. And of course, if we do take children into secure accommodation, CAFCAS have to be involved. They have to make a determination about whether that's in the children's best interest to do so. So it's a good safeguard. And we do listen and respond to any issues and concerns that they bring forward. So that's just another safeguard in the system to support looked after children and keep them safe.
Thank you, Gerard. Are you okay, Councillor Dale? Is it Neil?
It is, yeah,
Neil.
thank you. Thanks. I was just wondering, in terms of greater involvement of children and young people, the ICB and Public Health jointly commissioned the Young Health Champions service that Dudley CVS provides. And I'm just wondering whether that might present an opportunity both in terms of engaging with young people and also awareness raising amongst young people.
That's, yeah, absolutely. And it'd be really good to get their involvement. And one of the things that I know Gillian, our business manager, is looking at is having a kind of almost like a young person's meeting board to really kind of bring in the safeguarding element to that group of young people, so that we absolutely do hear their voice. And all the work that's going on in the Families First, shaping what our services will look like from a multi-agency perspective moving forward, is absolutely grounded in what children, families are telling us about what doesn't work at the moment. So I think there's some real opportunities over the next 12 months to really, really build that child and family voice.
Am I on? That's it. Thank you, Neil. I was going to ask a similar question, sorry, regards to the child's voice and family voice. Where are our challenges there?
I think for this cohort of children and young people, how can I put it? They're reluctant customers often. So when we're in that kind of safeguarding child protection world, people don't necessarily want to come together to talk about their experience, because actually the stigma attached, that's not a reason not to do it. It's just slightly more challenging. So we need to think more creatively about how we do capture their voice. And it tends to be a more fluid group. Our children in care, for example, tend to be, in our care for a period. So they come together, they make relationships, that they're a static group to some degree. whereas you could be involved in, for example, a social work service for, 3 months and then never again. So it's just a slightly more nuanced challenge.
Thank you. Do we have some of those groups set up in Dudley? We do. Thanks, Gerard.
Yeah, thanks. Yeah, it's a really important point actually about the voice of young people. We had a long discussion at our session this morning, which Vicky facilitated around our need to improve that. And we've had a recent Ofsted focus visit actually, and they've encouraged us to do more to involve not only children but their parents too, and also wider members of their families who play a crucial role in their lives. So there's more for us to do on that, but we've got some great arrangements in place. We've got a really strong children in care corporate parenting group, which some of you will have seen, and fantastic commitment from those young people to helping out other young people who are in the system. So we're very proud of them for doing that. But yes, we do need to do more to get beneath that and understand their individual lives. But that's what social work is about, really, which is getting behind the problem and understanding the person. And that's what we're trying to do. And generally, that's, we're doing very well about that, but we can always do better. And we hope that will come forward in the developing work of the partnership, but also in our further the publication of our focus visit letter, which will come on the 20th of November, and we're due our full ILACS inspection from next February. So I think members will have plenty of opportunities really to see our progress that we're making in relation to that development. But it should be and is at the heart of what we try and do. Thanks.
Thanks, Gerard. Thank you. Jason?
Thank you. Yeah, thanks, Vicky. And it was a really good session this morning. I had to leave before I could see some of the stuff followed up, unfortunately. But in terms of we had a good conversation on our table, which I don't know whether it got back to you, but looking at what the opportunities might be to work more closely with the adults board, and certainly thinking of those that tend to be in a bit of a revolving door when it comes to safeguarding. So we know that the adults involved and the children are involved, and actually how we can learn from listening to their experience and their voice. And obviously the data analysis will help in that role, will help a lot there, I assume. But it's what are the opportunities to make those two boards better connected, listen to those experiences and be able to flex accordingly.
Okay. Any further questions or comments? Councillor Westwood?
Yeah, going back to the little chart there, I was just looking at the last green square, which, like Kathy, I can't read from over there now. But it's basically the need for greater involvement from children, families and community groups. Well, I'd say there, if, as a community councillor, we're your people there, to bridge that no man's land. Because any councillor that knows their ward could help you greatly there. So I would say to extend that hand there, and I'd be, certainly I would be more than interested to sort of get involved and build that relationship there. Thank you.
Thank you. That's a really helpful offer. And one of the things that we're always conscious of is how we hear from some of those communities that are seldom heard. So that we, really do make an effort to hear right across. So that's a really helpful offer. Thank you.
Thank you, Gerard.
I think that's absolutely in line, Councillor, with what our ambition is for the Family First programme. And as some of you will know, we're moving from a position in which our services are really delivered around age banding. So our adolescent support teams, and then our younger people's family safeguarding teams. We're moving very much to be located around our family hubs, and the intention of that is to is to bring the rich resources in local communities together and putting our people, taking them out of Cable Plaza where they are mostly based now, out into the family hubs, and to be much more accessible and connected with the resources that families need every day and that are out there. And I do think there is, I agree with you, there is an untapped resource that we believe we'll benefit from by bringing our, by linking our services more closely into the into our communities, and those services will be delivered in slightly different ways to the very different communities that are in Dudley, and also the resources that they bring. So I absolutely agree with that as an opportunity that we're determined to take. Thank you.
Thank you. Is there any further questions or comments?
Yes, Chair. Sorry, I didn't know that would come over there, Chair. Sorry, as it is a public thing, Charlie just said that he wanted to ask a question, and I took the question from him, and I think I've kind of rephrased it by what he wanted to say. He's obviously listened to this, and Jason's point ties in very clearly. Charlie moved from children's services to adult services very swiftly. The placement that he was put in just wasn't acceptable before he came to live with us. The reason why these checks have to be done is the placement that Charlie was living in for quite a while. The people used to lock themselves in the attic away from him for days, and he would be left to feed himself and to look after himself. And one day they decided, when his mum was in hospital, to call, sorry, I'm going to cry, to call a social worker and ask to remove Charlie because he was disruptive, abusive, had broken things in there, which is just not Charlie at all. The reason why we need to make these checks must be robust, because placements like this still exist. Our care service isn't adequate, and we need to improve. Oh, I think that's what Kazee said to me. What happens if they end up in care? These placements are still out there, and these people are getting paid. So if we don't become robust, we unfortunately will be overrun with placements that are not adequate. So I think that's what you meant, wasn't it, Joel? Yeah.
Thank you, Councillor Dale. Thank you, Charlie. Thank you. Any further questions or comments? No? So if there's no further questions or comments, we'd like to refer members to recommendations set out in the report under paragraph 2 and ask the officers to note comments made by the committee. Does the committee agree? No. Thank you. Agenda 7. Are there any questions under Council Procedure Rule 11.8? Thank you. There are no further agenda items, so I declare this meeting closed. Thank you all for attending and for your contributions to the meeting, and have a safe journey home. Thank you.